These are newborns in Kenge, a small city in the Democratic Republic of Congo, wrapped in blankets and the nicest clothes parents could find in this remote part of the world. They're hesitant to open their eyes to new surroundings, but they would like what they would see. They are all born into a country where united efforts are successful in saving the lives of children and their mothers. It is shortly after 6 p.m. on a Thursday in a small neighborhood clinic. A young woman has given birth to a healthy boy, the grandmother singing songs of praise to Jesus outside the hospital window. The Democratic Republic of Congo is a country challenged by poverty. Only a few years ago, it had one of the highest maternal and child mortality rates in the world. Malaria is widespread, malnutrition a chronic problem. Over 10% of children were dying before the age of 5. Almost 1 in 100 women would die giving birth. In 2015, the Congolese Ministry of Health, having fought an uphill battle for decades, started to reorganize an inefficient system of health initiatives. Many initiatives focused on the same problems while leaving equally important health issues unsolved. Under the leadership of the Ministry of Health, a long list of organizations have aligned their expertise and financial resources behind the interventions that could have the biggest impact on the health and nutrition of women, children, and adolescents. The Global Financing Facility, World Bank, Global Fund to Fight AIDS, Tuberculosis and Malaria, Gavi, the Vaccine Alliance, UNICEF, UNFPA and USAID. The Global Financing Facility has really made an enormous contribution. First of all, it helped to establish the priorities, to identify high-impact initiatives that also have positive spin-offs for maternal and child health. It helped to focus attention on family planning, on initiatives in the areas of nutrition, water. All these elements were also instrumental for identifying action steps for working with the community. Under the new approach, we bring domestic and stakeholder funds together at the same time to finance a high-impact treatment package for maternal and child health, and we do so in a concerted fashion. In this way, the discordance, the lack of alignment among the actors actually no longer exists. The result, vastly improved efficiency. Not only has everyone access to services and drugs, the country also has been better prepared for Ebola outbreaks and other health emergencies. And with organizations now bundling and coordinating their efforts instead of going it all alone, the cost of medical treatment has gone down. Traditionally, one of the biggest obstacles for families here to seek medical help. And there are many medical cases that hinge on quick decisions where money should be the last issue to be discussed. This baby, brought in this morning, can be saved through swift action and because the hospital is stocked with proper medication. Lately, there has really been a change in the way patients are cared for. First of all, thanks to the support provided for the purchase of medicine from the Global Fund, supplies of medicine do come in, and these are accessible to all patients. This really helps us with treatment and care. What seems simple in developed countries can pose a giant challenge in the developing world. How do you get medical supplies, medication that often needs to stay refrigerated over thousands of miles into remote lands where you find few roads like this one? It takes a combined effort to have a reliable supply chain in a country almost a quarter the size of the United States. The Congolese health program SANRU, an implementer of the Global Fund, is a key player when it comes to logistics. Without medicine, there is no health program. This is why support is needed. The supply chain has to be improved, and this is one priority also of the GFF, of our platform, to improve and above all, rationalize the supply chain. And this is a task that we have begun to do together, all the partners, to see how to strengthen the supply chain. A reliable supply chain is one pillar of Congo's new health strategy. Equally important is a broad-minded, holistic approach to the country's health issues. The ability to combine medical and social issues in a treatment and prevention program is key. Take the issue of malnutrition. Organizations like UNICEF are forceful players that have saved hundreds of thousands of children, but the underlying problems of malnutrition cannot be solved with warehouses full of nutrition supplies alone. One of the keys was that we united certain sectors that were not very integrated, that were not communicating with each other. So, for example, for me the challenge is to tackle nutrition together with reproductive health. Malnutrition is more prevalent in families that have a lot of children, where early marriage is prevalent and young girls have children at a very young age. This integrated approach can be observed in communities all over the 14 provinces that have become a priority in improving the health of mothers and children. Pregnant women are being taught about the importance of breastfeeding their babies up to 2 years of age. Family planning is being made a priority, with contraceptive pills and injections available at no cost. We'll go to the health center. At the center, I'll take an injection. This first child will stay the only child for a while. He will go to school. I will live with that injection until then. We will have the second child later. The center gives us advice. To prevent malaria, mothers are given mosquito nets for their homes. And if you don't know how to put it up properly, there will be a community health worker who will assist you. Community health workers are locals like Jean-Pierre Binen, a respected school principal who visits private homes in his free time and advises families on a long list of health issues. Jean-Pierre inspects the mosquito nets and investigates where mosquitoes could breed on a family's property. This is correctly done. Don't leave your trash like that. You see the cans here? Mosquitoes are going to breed. Here's a tin can full of water. The mosquitoes will come and bite us. You can't do that, do you understand? And Jean-Pierre doesn't stop there. He'll go through a whole list of issues, from malaria to vaccination to hygiene to family planning, making sure this young family uses all the available resources. He visits 20 families a month, educating young and old on health essentials. Whenever children's health is monitored these days in the Democratic Republic of Congo, health workers can note better results than in the past. Children's health, on average, is improving. This measuring tape is indicating a child's growth, with the color green signaling normal growth of its upper arms. Which one of the health measures had a larger responsibility in making him a healthy child would be hard to tell, and it would hardly matter. It is results like this one that matter most to children and their mothers.